Every year, millions of seniors across the country head to their doctor's office for what's supposed to be a simple routine checkup. They book the appointment in good faith, follow through on all the recommended screenings, and leave the clinic with a sense of reassurance, believing they've taken the right steps to protect their health. They trust their doctor. They trust the process. And why wouldn't they? But what if I told you that some of the very tests you undergo during these routine visits, the tests you've been told are essential, safe, and preventative, might actually increase your risk of a stroke, sometimes within hours or days? It sounds shocking, even impossible. After all, we're taught to believe that early detection saves lives, and it often does. But hidden within the structure of modern medicine are silent risks that are rarely explained, quietly downplayed, or simply left out of the conversation. Not out of malice, and not due to negligence, but because these risks are seen as too rare to mention. Unfortunately, if you're over 60, rare doesn't mean irrelevant. The truth is, what's safe for a healthy 35-year-old isn't always safe for someone managing high blood pressure, vascular fragility, or reduced kidney function. Our bodies change as we age, and medical procedures that once posed little concern can now carry real consequences. Picture this. You get a clean bill of health after your checkup. You go home, eat dinner, relax. But the next morning, you feel off. Maybe you're dizzy. Maybe your vision is blurry. Maybe your balance is off and your thoughts feel foggy. You shrug it off, thinking it's nothing serious, but the symptoms linger or suddenly get worse. And now you're left wondering, could it have been something I did at that appointment? For some people, the answer may be yes. Because while many routine medical tests can detect serious problems early, some, when overused or performed without proper precautions, can unintentionally disrupt blood pressure, stress the cardiovascular system, or trigger reactions that set off a dangerous chain of events. Let's be absolutely clear, this is not fear-mongering. It's information that's often overlooked, even by well-meaning professionals. And it's especially important for seniors who want to stay proactive, informed, and safe. Because once you're over 60, staying healthy isn't just about finding disease early. It's also about avoiding unnecessary interventions that could cause harm. So in this video, we're going to talk about 5 common medical tests that carry unexpected stroke risks, particularly in older adults. We'll break down how each one works, what the risks are, and most importantly, the smart questions you should be asking before saying yes. If you're over 60, type a 1 in the comments. If you're younger, type 0, and be sure to subscribe to Health 365, where we talk about the things most others won't. Now let's dive into the first test, one that almost no one questions, but maybe should. CT scans with contrast, what you're not told. If you've ever had a CT scan with contrast, you might remember that sudden warm sensation, sometimes even a metallic taste in your mouth, or a feeling like you've wet yourself. That's the contrast dye moving through your bloodstream, helping doctors get a clearer image of your organs, blood vessels, and tissues. Sounds high-tech, sounds helpful, and often it is. But here's what almost no one tells seniors. That same dye, while incredibly useful, can also place extra stress on your heart, blood vessels, and kidneys. And if you're already dealing with hypertension, cardiovascular disease, or kidney issues, that extra stress can become dangerous. Let's talk about how. In some people, the contrast triggers what's called a vasovagal reaction, a sudden, dramatic drop in heart rate and blood pressure. That might not sound serious, but for someone with vascular issues, it can lead to dizziness, fainting, or even reduced blood flow to the brain. But for others, the opposite happens. The blood pressure spikes instead, blood vessels constrict. And that's when the risk of a mini stroke, full stroke, or cardiac event increases. A study published in the Journal of Vascular and Interventional Radiology followed thousands of seniors who underwent contrast-enhanced CT scans. The results? Within just 72 hours, a significantly higher number of patients, particularly those with a history of high blood pressure or cardiovascular conditions, experienced vascular complications. Let me share a real example. An 81-year-old man went in for a routine CT scan to check on some mild digestive discomfort. Nothing serious. The scan came back clear. He went home relieved. But 2 days later, he suffered a minor stroke. Doctors traced the likely cause back to the scan. The contrast dye may have spiked his blood pressure just enough to dislodge a small clot, which then traveled to his brain. Now, let's be fair. CT scans with contrast save lives. They can detect tumors, aneurysms, internal bleeding, things that could kill if missed. The goal here isn't to scare you away from vital diagnostics. The goal is informed choice. Because for seniors, especially those with heart or kidney concerns, a contrast-enhanced scan shouldn't be done just to be safe or as part of a routine annual screening. It should be clinically necessary. So, what should you do if your doctor recommends a CT scan with contrast? Ask, is this scan absolutely necessary? Are there alternative imaging options that don't require contrast? Have you reviewed my kidney function and blood pressure before scheduling this? Make sure your doctor knows about any history of hypertension, kidney disease, even mild, previous reactions to contrast dye, medications that affect your heart or fluid balance. And if you're unsure, ask for a non-contrast version of the scan or see if an ultrasound or MRI without contrast might provide the same answers more safely. You have the right to slow down, ask questions, and make the safest choice for your body, not just the default one. Coming up next, we'll talk about another test that seems perfectly routine. But for some seniors, it may be pushing their heart and brain into dangerous territory without them even realizing it. So what should you do? Ask your doctor. Start with a simple but powerful question. Is this scan absolutely necessary, or is there a safer alternative considering my age, medical history, and current condition? Be transparent about every detail of your health. Tell your doctor if you have high blood pressure, kidney problems, heart disease, past reactions to contrast dye or sedation, and always follow up with, could this test be done without contrast, or is there a different method that's just as effective but less risky for me? Sometimes a non-contrast CT, MRI, or even an ultrasound can provide the answers your doctor needs without putting extra stress on your heart, kidneys, or brain. The stress test. Exercise isn't always harmless. The exercise stress test sounds harmless. Strap on a monitor, jog on a treadmill, and test how your heart responds. For many people, it's a good tool. But for older adults, especially those with high blood pressure or any history of cardiovascular issues, this test can do more harm than good. Why? Because it pushes your body hard, fast. Heart rate climbs, blood pressure spikes, and your circulatory system gets pushed to its limits. That's manageable for a 35-year-old, but for someone 65 plus, with plaque buildup or weakened vessels, it can be risky. Possible complications include sudden spikes in blood pressure, irregular heart rhythms, chest pain, dizziness or fainting. In rare cases, small vessel damage in the brain. A 2020 study from the American Journal of Cardiology tracked over 1,300 seniors doing treadmill stress tests. About 7% experienced adverse effects. That's 1 in 14 people. Many had vascular issues they didn't even know about. Take Margaret from Ohio. She was 74 with long-term high blood pressure but no recent symptoms. Her doctor ordered a stress test as a routine precaution. Halfway through, she got dizzy and had chest tightness. The test stopped. The next morning, she had a minor stroke. It wasn't the treadmill alone that caused it, but the stress it put on her system triggered a chain reaction her body couldn't manage. So always ask, is there a safer way to assess my heart? Sometimes a medication-based stress test is better. Other times, a resting echocardiogram or blood work can give plenty of information. If you're not experiencing symptoms like fatigue, shortness of breath, or chest pain, it may even be better to wait. What's coming next? Still with us? Good, because the next section dives into something most people accept without question: sedated procedures like endoscopies. These are common in older adults, but when you mix sedation with blood thinners, age-related changes, and certain medications, the stroke risk can rise. We'll explain why, how to prepare, and what to ask your doctor before agreeing. If you're learning something valuable here, hit the like button. It helps others find this too. And subscribe to Health 365 if you haven't already. Now, this doesn't mean all endoscopies are bad. Sometimes they're vital. But if your doctor says, it's been a few years, we should do one, that's not always a good enough reason. Instead, ask, is there a less invasive way to monitor my condition, especially since I have no symptoms right now? And one more crucial thing, review your medications. If you're on blood thinners, ask, will I need to stop this before the procedure? What are the risks of sedation given my age and medical background? If you're worried about being sedated, say so. Ask if there's a lighter option, or if it's possible to do the procedure without full sedation at all. MRIs with contrast, a hidden risk for older adults. MRIs are incredibly useful. They can detect tumors, injuries, or hidden problems early. But when contrast dye is added to enhance the image, there are extra risks for older adults, especially those with kidney issues. The dye often contains gadolinium, a heavy metal. Normally, your kidneys flush it out, but after age 60, kidney function slows down. And if you have even mild damage, diagnosed or not, your body might not clear the gadolinium properly. When that happens, gadolinium can remain in your tissues. In rare cases, it causes nephrogenic systemic fibrosis, NSF, a painful, sometimes debilitating condition. More recent studies have found traces of gadolinium in brain tissue too. This has led researchers to examine possible neurological effects, dizziness, memory issues, or disorientation. A 2019 study in radiology followed over 2,000 patients 65 plus. About 5% experienced symptoms like blurred vision and balance problems after contrast-enhanced MRIs. Most had undiagnosed kidney issues. Take Harold, 79, from Arizona. He got an MRI for back pain. No one checked his kidneys. 2 days later, he felt foggy, dizzy, and weak. A test later showed stage 3 kidney disease. So ask your doctor, can we do this MRI without contrast? And if contrast is necessary, can we test my kidney function first? It's a simple blood test called a GFR. It gives doctors insight into how well your kidneys can handle the dye. Also, let your provider know about any past reactions you've had. Often, alternative methods exist that pose far less risk. The carotid ultrasound, helpful or harmful? Carotid artery ultrasounds sound harmless. No needles, no radiation, just a quick scan of your neck to check blood flow to the brain. But here's the catch. If you don't have symptoms, like dizziness or vision changes, this test might lead to unnecessary procedures. Here's how it happens. A scan shows 50% or 60% narrowing in your arteries. That sounds alarming, so you're referred to a vascular surgeon. Soon, there's talk of stents or surgery. But many of these procedures aren't needed unless the narrowing is severe and causing symptoms. A major study in the New England Journal of Medicine found that seniors with moderate narrowing but no symptoms did just as well with medications and lifestyle changes without the risks of surgery. Sometimes the surgery itself can cause a stroke. Helen, 82, from Pennsylvania, had a scan that showed 65% narrowing, no symptoms, but she was fast-tracked to surgery. During the procedure, she suffered a stroke and now lives with right-side weakness. She later said, "I wish I'd asked more questions." So you should ask, what are we looking for with this scan? Will the results change my treatment or just lead to more tests? If you're already managing blood pressure and cholesterol and feel fine, you may not need any intervention at all. Always get a second opinion before agreeing to any vascular surgery. Final thoughts. Be informed. Be confident. Not all tests are dangerous, but not all are necessary, especially after 60. The older we get, the more sensitive our systems become. Things that were routine in our 30s or 40s, like contrast dye, sedation, or exercise-based testing, now carry new risks. That doesn't mean you should avoid care. It means you should be informed. Always ask, is this really essential for me? Is there a gentler, safer way to get the same information? Because when you know more, you choose better. And that leads to safer, smarter healthcare. If this video helped you think differently about your medical choices, let us know in the comments. Drop a 1 if you've ever had a strange reaction to a test. Drop a 0 if not. And subscribe for more honest, thoughtful conversations about aging, health, and safety. Because at Smart Health 365, we believe your life should be guided by facts, not fear.